Dr. Richard Thompson was a family physician, age 62. He diagnosed hundreds of cases of prostate issues in his patients. He knew the symptoms by heart, yet he missed them in himself for 18 months. It started with nighttime urination. "I'm getting older," he told himself. "This is normal." Then urgency during the day. "I'm drinking more water, trying to stay hydrated." Lower back discomfort. Long days standing at clinic. Occupational hazard. Increased urinary frequency. Probably too much coffee. Fatigue. Busy practice. Not enough sleep. Hip stiffness in the mornings. Need to stretch more. Weaker stream when urinating. Just getting older. Happens to everyone. One day, a nurse practitioner colleague mentioned her husband's recent prostate diagnosis. "What were his symptoms?" Dr. Thompson asked. She listed them: nighttime urination, urgency, frequency, back pain, fatigue, hip stiffness, weak stream. Dr. Thompson went silent. "I have all of those," he said. She looked at him. "When was your last PSA?" 3 years ago? Maybe get it checked?" Dr. Thompson ordered his own PSA test. Result, 10.2. He sat in his office, stunned. "I'm a doctor," he said to his colleague. "I diagnose this condition every single week. I know the symptoms. How did I miss it in myself for 18 months? His colleague explained what he already knew intellectually, but had failed to apply personally. Because each symptom alone has a reasonable explanation. You're tired because you work hard. Your back hurts because you stand all day. You wake up at night because you're aging. It's only when you see all the symptoms together that the pattern becomes obvious." Dr. Thompson later shared his story at a medical conference. If a family physician who treats prostate issues regularly can miss his own symptoms for 18 months, imagine how easily our patients miss them. We need to educate men about the full symptom pattern, not just the obvious urinary changes. All 8 symptoms, including the ones that seem completely unrelated to the prostate. Today, I'm showing you the 8 prostate symptoms that even a physician missed in himself, why having medical knowledge doesn't make you immune to denial, and how to recognize the pattern before it reaches a critical point. If a doctor who treats this condition daily can miss these 8 symptoms, you absolutely can too. This video is for education only, not medical advice. Always consult your doctor about symptoms. Never self-diagnose from videos. Before we start, comment symptoms below right now. I'll send you a free printable checklist to track these 8 symptoms and share with your doctor. Takes 2 seconds. Could save you years. Now let me show you what to watch for. Symptom number 8, occasional nighttime urination. This is almost always the first symptom men notice. Or more accurately, the first symptom that appears. Most don't notice it as concerning. Waking up once per night to urinate seems normal, especially after age 50. But here's what research shows. Waking once consistently every night is an early warning sign. Twice per night means the issue is progressing. Why it happens. Your prostate is beginning to enlarge or become inflamed. This irritates your bladder. Your bladder becomes more sensitive, sends urgent signals even when not completely full. Statistics show 70% of men dismiss this symptom as normal aging. Dr. Thompson's journal, month 2. Started waking up once at night, usually around 3 a.m. Must be drinking too much water before bed. That's the excuse he used. Drinking water. Reality, his water intake hadn't changed. His prostate had. When to be concerned? If you're consistently waking 1 or more times nightly, and this is new within the past 6 months, pay attention, especially if combined with any other symptoms we'll discuss. This symptom typically appears first, 6 to 12 months before most men notice anything else. Symptom number 7, increased daytime urinary frequency. You're going to the bathroom more often during the day. Used to be every 3 to 4 hours. Now it's every 1 to 2 hours. You blame water intake, or coffee, or tea. But here's the key. Your fluid intake hasn't actually increased. You're just urinating more frequently with the same amount of fluid. Real cause. Your prostate is pressing on your bladder, reducing effective bladder capacity. Your bladder feels full when it's only half full. This symptom typically appears 3 to 6 months after nighttime urination starts. Dr. Thompson's journal, month 5. Noticing I need bathroom breaks more often at work, every hour or two instead of every few hours, probably because I'm staying better hydrated. His excuse? Better hydration. Reality: his fluid intake was consistent. His bladder capacity was effectively reduced. Red flag indicator: frequency increases without corresponding increase in fluid consumption. Or frequency increases, but urine volume per trip stays small. By the time this symptom appears, you've likely had symptom 8 for several months. Most men still don't connect these two symptoms as related. Symptom number 6, sudden urgency. This is different from frequency. Frequency means you need to go often. Urgency means when you need to go now, can barely hold it, sometimes barely make it to the bathroom. You start planning trips around bathroom locations. Won't go anywhere without knowing where bathrooms are. Mechanism: the bladder neck becomes irritated from chronic inflammation. Sends urgent signals to your brain, even when bladder isn't very full. This symptom typically appears 6 to 9 months into the progression. Dr. Thompson's journal, month 8. Experienced several instances of sudden urgent need to urinate. Once, almost didn't make it, probably just holding it too long during busy clinic days. His excuse: too busy to go when needed. Reality: he wasn't holding it longer than before. His bladder signals had become more urgent. When urgency is concerning, if you're experiencing sudden intense urges that are difficult to control, especially if this is new, especially combined with frequency and nighttime urination. At this point, you have 3 distinct symptoms. Most men still attribute each to separate causes. Don't see the pattern. Symptom number 5, lower back discomfort. This is where the connection typically gets missed completely. Lower back pain seems entirely unrelated to your prostate. Dull, persistent ache, usually lower lumbar region, especially noticeable in the morning. You blame your mattress, your posture, sitting too much, standing too much. You try new mattresses, stretching, massage, physical therapy. Back pain doesn't improve much. Why this happens? Prostate inflammation can cause referred pain. Pain signals from the prostate get interpreted by your brain as coming from your lower back. This is well documented in medical literature, but rarely explained to patients. Statistics: 40% of men with prostate issues report lower back discomfort. Most initially attributed it to musculoskeletal causes. Dr. Thompson's journal, month 10. Lower back has been bothering me for weeks. Dull ache, worse in the morning, probably from standing all day at the clinic. Scheduled massage appointment. His excuse: occupational strain from standing. Reality: his prostate inflammation was creating referred pain. How to tell if back pain is prostate related? It's a dull, persistent ache rather than sharp, shooting pain located in lower lumbar region. Often accompanies urinary symptoms. Improves when prostate inflammation improves. By month 10, Dr. Thompson had 4 distinct symptoms. Still didn't connect them. Symptom number 4, hip and pelvic stiffness. Your hips feel tight, especially in the morning. Getting out of bed feels stiff and uncomfortable. Takes several minutes of movement before hips loosen up. You blame arthritis, age, not stretching enough, previous injuries. Mechanism: prostate inflammation creates tension in your pelvic floor muscles. These muscles connect throughout your hip region. Chronic tension in pelvic floor creates stiffness in hips, often appears alongside lower back discomfort. Pattern: stiffness is worse at night and first thing in the morning. Improves somewhat during the day with movement. Returns in the evening. Dr. Thompson's journal, month 12. Hip stiffness in the mornings getting worse. Takes 10 to 15 minutes before I can walk normally. Need to stretch more regularly and maybe start yoga. His excuse: need more stretching and flexibility work. Reality: his pelvic floor was chronically tight from prostate inflammation. This symptom is particularly insidious because it genuinely does improve with stretching and movement. So stretching seems to work, but the underlying cause remains. Stiffness keeps returning. 5 symptoms now, 12 months into the progression. Still no recognition of the pattern. Symptom number 3, persistent fatigue. Not just tired, exhausted, sleep 8 hours, but wake up feeling unrested, need naps during the day, energy levels consistently lower than they used to be. You blame stress, busy schedule, not enough sleep, getting older, maybe depression. Why this happens? 2 mechanisms working together. First, chronic inflammation anywhere in your body is energetically expensive. Your immune system is constantly activated. This drains energy. Second, you're not sleeping well because you're waking up multiple times nightly to urinate. Interrupted sleep prevents deep, restorative sleep stages. Statistics: 60% of men with prostate issues report persistent fatigue. Most initially attribute it to stress or aging. Dr. Thompson's journal, month 14. Feeling tired constantly despite sleeping full nights. Probably just exhausted from busy practice. Maybe need vacation. His excuse: work stress and burnout. Reality: chronic inflammation plus interrupted sleep from nighttime urination was draining his energy. Red flag: fatigue that doesn't improve with adequate sleep. Fatigue combined with other symptoms on this list. Fatigue that's persistent for months without clear cause like illness or major life stress. This isn't depression. This isn't burnout. This is physiological fatigue from chronic inflammation and disrupted sleep. 6 symptoms present now. Most men at this stage finally start thinking, maybe I should mention this to my doctor, but they still don't connect all the symptoms together. Symptom number 2, weak urinary stream. Your stream when you urinate is noticeably weaker. Takes longer to empty your bladder completely. Stream sometimes starts and stops instead of being continuous. You might need to push or strain to maintain flow. This is usually the symptom that makes men first think, this might be my prostate. But by the time this symptom appears, you've likely had 5 to 6 other symptoms for months. Mechanism: your enlarged prostate is compressing your urethra. The tube that carries urine from your bladder. Narrowed passage means weaker stream and longer emptying time. Progression usually starts intermittently. Some days stream is normal. Other days it's weak. Over time, becomes consistently weak, often accompanied by sensation that bladder hasn't completely emptied even after urinating. Dr. Thompson's journal, month 16. Stream seems weaker lately, takes longer to finish urinating, probably just natural aging process. His excuse: normal aging. Reality: his prostate was now significantly compressing his urethra. By this symptom, most men finally schedule a doctor appointment, but they've had the condition progressing for 12 to 18 months already. 7 symptoms now. The pattern should be obvious, but because symptoms developed gradually, one at a time, over many months, most men still don't see the full picture. Symptom number 1, visible changes that cannot be ignored. These are the symptoms that finally, undeniably, force men to seek medical attention. Blood in urine, even just once, pink or red tinge, painful urination or burning sensation, pain during or after ejaculation, significant changes in sexual function, reduced force, difficulty achieving or maintaining erection. These are late-stage symptoms. By the time any of these appear, you've likely had symptoms for 12 to 24 months. These symptoms can't be attributed to aging or stress or coffee intake. They're undeniable, concerning, force immediate action. Dr. Thompson noticed blood in his urine once at month 18. That's when he finally ordered his PSA test. Result: 10.2. By this point, he'd had 7 other symptoms for months. But this one symptom, the blood, is what finally made him take action. Why these symptoms appear last? They indicate more significant prostate issues, either more severe inflammation, or more significant enlargement, or in some cases, more serious conditions. The tragedy: all the earlier symptoms were warnings, opportunities for earlier intervention, earlier treatment, better outcomes, but most men don't recognize symptoms 8 through 3 as prostate-related, don't mention them to doctors, don't seek help until symptom 1 or 2 forces them to. Here's what Dr. Thompson realized after his diagnosis. Looking back at his journal, the progression was clear. Month 2, symptom 8, nighttime urination begins. Month 5, symptom 7, daytime frequency increases. Month 8, symptom 6, urgency develops. Month 10, symptom 5, back pain starts. Month 12, symptom 4, hip stiffness appears. Month 14, symptom 3, persistent fatigue sets in. Month 16, symptom 2, weak stream becomes noticeable. Month 18, symptom 1, blood in urine, finally gets tested. 18 months from first symptom to diagnosis, PSA 10.2 by the time he finally tested. At his medical conference presentation, Dr. Thompson shared research. Average delay from first symptom to diagnosis, 14 months. Why? Because each symptom alone seems unrelated or attributable to aging. Most men have 4 to 5 symptoms before recognizing any as prostate-related. By the time symptom 1 or 2 appears, forcing action, earlier symptoms have been present for over a year. The pattern is only obvious in hindsight. Looking forward, experiencing symptoms gradually, each one has a plausible alternative explanation. That's the insidious nature of prostate symptom progression. And that's why awareness of the full pattern matters so critically. Right now, count how many of these 8 symptoms you're currently experiencing. Be honest with yourself. 0 to 1 symptom, stay aware, monitor for changes, get annual PSA testing after age 50, after 45 if you have family history. 2 to 3 symptoms, schedule a doctor appointment within the next month. Bring a list of all symptoms. Ask specifically about your prostate. Request PSA test if not done recently. 4 or more symptoms. Schedule an appointment within the next week. This is not an emergency, but it's not something to delay for months. The pattern is present. Your prostate needs evaluation. Don't wait for symptom number 1, blood in urine, pain, significant dysfunction. By that point, you've had the condition progressing for potentially a year or more. Early symptoms, 8 through 6, are your advantage, your opportunity for earlier intervention. What to tell your doctor. I have multiple symptoms that might be connected to my prostate. I'd like to discuss them and potentially get tested. Then list all your symptoms, even the ones that seem unrelated like back pain or fatigue. Let your doctor decide what's connected. Don't self-edit before the appointment. Request a PSA test if you haven't had one within the past year. If possible, bring a timeline, when each symptom started, how it's progressed. Dr. Thompson now does this with all his patients over 50. Asks about all 8 symptoms systematically, not just the obvious urinary changes. Early detection makes a significant difference in treatment options and outcomes. At that medical conference, Dr. Thompson gave specific advice to both physicians and patients. To physicians, ask about the full pattern, not just daytime urinary symptoms. Ask about nighttime urination, fatigue, back discomfort, sexual function changes, all of it. Create a complete picture. To patients, write down every symptom, even if it seems completely unrelated to your prostate, sleep changes, back pain, energy levels, hip stiffness, everything. Let your doctor decide what's connected. Don't self-edit. Dr. Thompson's personal outcome. He started treatment shortly after diagnosis. Because he caught it relatively early despite the 18-month delay, treatment options were available. Prognosis good. His PSA is now well controlled, symptoms significantly improved. But he reflects, if I'd recognized the pattern at month 5 or 6, when I had 3 symptoms, treatment would have been even simpler. Outcomes potentially even better. The colleague who asked about my PSA saved me from further delay. But you might not have that colleague. You might not work in a medical office. So you need to recognize the pattern yourself. That's why I share my story. A cautionary tale from someone who should have known better. Early symptoms are subtle. Late symptoms are undeniable. Don't wait for undeniable. Right now, comment symptoms below. I'll send you the free printable checklist. 8 symptoms with tracking space for each one. Questions to ask your doctor. PSA testing guidelines. Timeline template. Completely free. No email address required. Just comment, symptoms. This checklist gives you structure to track the pattern we discussed today. Share it with your doctor at your next appointment. It could literally save you months or years of delay. Subscribe to this channel because next week I'm revealing the 5 foods that make these symptoms significantly worse. Foods you're probably eating daily without realizing they're affecting your prostate. Most men eat at least 3 of them every single day.